It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, Indiana has a new state health commissioner. Governor Holcomb appointing Community Health Network OB-GYN Dr. Kristina Box to that position. That became open when former Commissioner Dr. Jerome Adams was named U.S. Surgeon General. And I'm pleased now to be joined by Indiana State Health Commissioner Chris Box. And Chris, welcome to the program.
Thank you, Gary. Thanks for having me.
You have a very lengthy career as an OB-GYN. All those years at Community Health Network, 30 plus years. Why, when you got the call to be the state's new health commissioner, why take the position?
Well, I have, over the years, always done missions trips abroad to Bolivia or Haiti, and decided a couple of years ago that my mission field was going to be here at home, because after 30 years of obstetrics and gynecology, I really hadn't seen a decrease in the infant mortality across our state. So my desire was to just try to help with that.
Well, let's talk about some of your real focus areas and priorities. One is infant mortality, as you mentioned. Talk about the challenge. It's been a challenge in Indiana for a number of years. Talk about that challenge and how you'd like to see the state really attack it.
So we run probably 613 babies in the year of 2015, didn't make it to their first birthday. Our rate is always one of the higher ones in the nation for infant mortality. And despite some really great efforts that have been made, we just have not really been able to impact that. We've brought the infant mortality rate for the Black population down, but it's still two times higher than our white population. So we have a lot of areas that we can attack. In general, if we attack the health of the people of Indiana, we'll improve our infant mortality also.
Yeah. Opioid abuse, addiction is a huge issue in Indiana, obviously. There's a human toll, there's a business toll in the state. It's that way in many states across the country. Obviously, that's a priority. How are you looking at that addiction issue and really attacking that?
Well, as you know, the number of overdose deaths in Indiana has gone up significantly, probably about 60% from 2011 to 2016. So one thing to try to help with that is to get the naloxone out there, and I've got a standing order across the state so that people can get naloxone. We obviously have it in the hands of our first responders, but more importantly, also making sure that if you have a family member that you feel is at risk, or a neighbor or someone close to you, you can go to a pharmacy nearby and get the naloxone yourself and have it to administer. We're also working very hard to make sure that people who inject drugs with needles do not spread HIV and hepatitis C across our state. We're working to try to get more treatment programs open and to try to make sure that the beds that are open are available to patients. So Dr. Walthall with FSSA has worked very hard to get kind of an open bed policy set up where you can actually, whenever that patient is ready for treatment, whenever the patient hits the emergency room with a drug overdose, if they say they're ready, we can get on 211 and determine where the nearest bed for them to obtain treatment is.
Such a daunting challenge, so many aspects to it. How important in your view is that early education, getting to young people, you know, again, as they are young people?
So substance use disorder is a chronic disease, and we know that once you get addicted, that is going to be times of relapse and times where you're sober or not addicted at that moment. So the reality is that what we need to do is make sure we're training our younger people, just like with not smoking, that they never try the drugs. Especially younger people are at risk for becoming addicted because their brains are just more susceptible to that. So starting at a very young age, in elementary school, actually, to talk about not using drugs and the negative effects of using drugs.
Indiana, speaking of smoking, the Indiana Chamber of Commerce is out supporting an increase in the minimum age to 21. I assume you support that, but your thoughts on that move?
Most definitely. Since most smokers start, about 90% of them start before the age of 18, I think it's really important to try to keep cigarettes out of the hands of our young adults. And most smokers, probably 99% of them by the age of 26.
Final question as we wrap up, but just the overall health of the state of Indiana, the general health, it's not been good. The state hasn't ranked very well in recent years. How do you look to kind of get to that overall health? Is it a gradual, over time kind of thing?
Right. At the health department, we would really like to start focusing on the healthy aspects of life, exercising regularly, at least 30 minutes a day, watching your weight, because we do have such a significant percentage of Hoosiers that are overweight. And unfortunately, 1/3 of our children have obesity, and that tends to go into adult life also. So that increases the risk for diabetes, high blood pressure, heart attacks, strokes.
Yep. All right, Dr. Chris Box is the state's new health commissioner. Thank you for coming on the show.
Thanks
you got a
for
lot
having
on
me.
your plate. I know we look forward to having you on the show in the future.
Anytime. Thanks again.